Hi, good morning. This is Dr. Mark Sehl of the YouTube channel Therapy for the Heart. Today I'm bringing you the 24th video on what makes for a good psychotherapy session. How does therapy help with the problem of perfection? In the last talk on being imperfect, I discussed how the drive for perfection leads to attacks on the self and creates symptoms of anxiety, depression, fear of failure, and at times suicide. How does therapy counter the drive for perfection? Therapy helps with perfection by not expecting it. Except for therapy, where else do we get the chance to freely express our thoughts and feelings? We have so much pressure to put on a certain social face for the boss, spouse, parents, peers, so much pressure to please the other. So much pressure in these circumstances to say and do the perfect thing. Therapy is a place where someone can tell the story of their life, where a person listens without judgment or expectation. The therapist listens to everything, even what the patient feels are the most insignificant details, and listens with interest and focus. Because in the therapist's mind, everything that is said is significant. I like to know all the details because the story is in the details. Someone might be talking about an encounter with some friends at a party, and they're talking about how Jane was approaching Bill, and blah 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 blah. And I want to know, well, what was blah 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 blah? And I want to know all things and everything. So when somebody starts to talk about blah, 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 you find out it was very important and was going to be dismissed as insignificant. I like Freud's example when he described free association. He said, imagine you're on a train and you're moving through the countryside and you're looking through the window and you're going to report everything that you see without censorship. Report everything that you see. And that's what free association is. So someone just doesn't come into the room with me and I ask them to free associate, because free association is very difficult to achieve. But on the other hand, that's the basic way I like to conduct therapy, is to help somebody say spontaneously everything that's on their mind. In free association, or free speak, as I like to call it, there is more chance to access spontaneous thoughts and images. This provides the opportunity for surprise rather than the more structured kind of back and forth talking we are used to. So in psychoanalysis, I am building a relationship of trust so that this person can eventually feel free to tell me the things that they have not been able to tell anyone due to fear, guilt, and shame. Compare this with the therapies like evidence-based therapies, CBT, where the emphasis is often on structure, reframing, doing homework, keeping diaries. The evidence-based therapies, CBT, etc., have been getting the most press until Dr. Jonathan Shedler in 2010 did a mega study, one of the most important research studies regarding the efficacy of psychodynamic psychotherapy. The study found that effect sizes, the strength of the relationship, for psychodynamic therapies are as large as those reported for other treatments that have been actively promoted as empirically supported and evidence-based. It indicates that the often unacknowledged active ingredients of other therapies include techniques and processes that have been core, centrally defined features of psychodynamic treatment. Reinventing the wheel. Finally, the evidence indicates that the benefits of psychodynamic treatment are lasting and not just transitory, and appear to extend well beyond symptom remission. For many people, psychodynamic therapy may foster inner resources and capacities that allow richer, freer, and more fulfilling lives. Ironically, this paper established psychodynamic therapy as evidence-based. Psychoanalysts and the psychodynamic therapists have long been on the defensive since this new evidence-based therapy. It has been, promoted and supported by the insurance companies, and everybody's talking about CBT. Well, look at Jonathan Shett's paper, please. It's a wake-up call. I like to think of the psychoanalysis I do as an art form rather than an evidence-based form of treatment, even though it's now an evidence-based form of treatment. For years I have been practicing psychoanalysis and proud of it. By the way, if you want to know the difference between modern psychoanalysis and classical psychoanalysis, you can look at Talk 3. I practice modern psychoanalysis, although I was classically trained. Listening without expectation is instrumental in avoiding the pitfalls of expecting perfection. How many parents will ask a child, for instance, to talk about something, maybe a movie they went to, and then suddenly in the middle of it, the parent will say, well, by the way, I just saw this movie yesterday, and I wanted to tell you about it. And all of a sudden, there's no conversation anymore. It's a one-way dialogue. Or somebody might be talking, parents or friends, spouse, or might be talking about colleges that they're looking into, and somebody might say, well, I was checking out College X, and then somebody else says, oh, College X, well, they don't have a very good reputation. So many ways people really don't want to listen to what you have to say. They want to sometimes give a little lecture on what their opinion is. Silence of the therapist is an important part of therapy. Silence is a non-intrusive, accepting intervention that waits for the patient to evolve. I like that, evolve. And the idea of waiting for someone to show themselves and with patience and without being judging is in terms of what they're having to say. And this is the first time they might, in their life, they might be encountering a situation where somebody's really going to listen to what they have to say and want to know about them, what they think and what they feel. One of my most viewed videos, Silence as an Intervention, talks about the benefits of silence, so you can refer back to that. Often analysts are uncomfortable with silence because they feel they have to do something. So an analyst may rush in with an interpretation or maybe start to talk when it's not necessary to talk. Enough time wasn't given so that the patient can struggle through a few moments of silence. It's a good exercise. The therapist might rush in with intervene to counter feelings, often counter feelings of inadequacy. And many therapists, even experienced therapists and particularly new therapists, feel they have to do something. And then that when they're not doing something, then they feel inadequate and inferior. So therapists have their own problems with perfection. It's a profession where the pressure to be perfect is built into it. For some reason, psychotherapists and analysts, I guess, I don't know what it is, but they feel like they have to know more than anybody else about everything. Because they are psychoanalysts or psychotherapists. I'm not speaking for everybody, but I know that I run into that a lot with peers struggling with their mistakes that they made and feeling bad about it. I struggle with many aspects of doing therapy, but I work hard at understanding them, not that other people don't, but I as you can see, particularly pay a lot of attention to trying to understand what I do and to explain it to others and also to learn from my mistakes. Silence does not mean that the therapist does not talk. Talking is provided when the patient needs it. If the silence is too frustrating, it may be experienced as an uncaring act. A good therapist can tell when the silence is smooth and comfortable for the patient or too difficult and then help the patient with it. Here is an example of the opposite of waiting for someone to evolve. In one talk I gave this example, and I want to repeat it, was observing a caregiver on a bus feeding an infant. As the infant reached up to hold the spoon, the caregiver impatiently grabbed the spoon and shoved it down the infant's mouth. This was repeated over and over and over again. It was very frustrating to watch. After a while, the infant gave up trying. This could lead to resignation and depression later on in life. This is analogous to a therapist, rather than enduring silence, starts to talk or makes an interpretation about the meaning of the patient's silence. We're not really here to give meaning. We want to inquire about meaning and what someone else ideas are about what they're saying, rather than providing our wisdom and great knowledge, because we want to find out what somebody else's wisdom is and what they think and feel. That's establishing a relationship. That's a two-sided relationship where you're really listening. And the therapist often learns too from the patient, so that's a very important aspect of therapy. It's not just teacher-student. We're not there to give meanings. We want the patient to find meanings. The therapist, not tolerating the silence, may say to the patient, "You are uncharacteristically quiet today." The person feels all of a sudden they are not doing it right. They didn't handle the silence in the right way. Why questions call forth the silent attacks on the self. I'm stupid. I can't even do therapy right. Those are the interjects that we talked about in many of the talks, where we want to try to work so that the patient moves those interjects out of the ego and into the object world, and that's going to be on the therapist, who's the object world, and the love, the hate, and all the feelings hopefully will be addressed to the therapist, and the patient can then reduce their interjects and self-hate and self-attacks. A lot goes on in silence. The person needs time to wait, to think, search for the words, to create the moment, help create the connection between patient and analyst. That is why therapists wait. They're waiting for moments that will be created by the patient. You can refer back to the talk on following the contact function for more on this. D.W. Winnicott, a great psychoanalytic thinker, wrote an article, "To Be Alone in the Presence of Another." That's from 1958. He talks about the developmental achievement of the infant to be alone in the presence of its mother, to be able to enjoy this state. And without this achievement, the capacity to be alone will not sufficiently develop. So an analyst's interpretation of silence as a resistance may be making a fundamental mistake, because the patient may miss having the opportunity to learn with a non-intrusive analyst to develop this capacity to be alone for the first time. It's another side benefit of being in therapy. This capacity to be alone is so important in development. It means that a child can entertain itself, play in the presence of a mother, enjoy the time together without intrusion. A very anxious mother will go into overdrive at times at the slightest hint of discomfort on the infant's part, and to the therapist will go into overdrive and start to ask questions. The mother will be all over the infant. That's where it starts, rather than let the child tolerate the discomfort and probably work it out for herself. In order to counteract the problems of perfection, that's what we're talking about, right? How to counteract, and how this therapy can counteract the drive for perfection. The analyst needs to be committed to an ongoing awareness of his or her contribution to problems that arise in conducting therapy. Needing to be right, to be perfect, to be liked. Needing not to be hated. That's a big one. That's a big problem with therapists. The best therapy that they can do is to help the patient be angry and hate them, and for reasons that we've talked about in many of the talks, that could be a big resistance on the therapist's part, because they have too much of a need to be liked. What makes for mental health is the ability for the patient and the analyst, both parties, to tolerate and understand feelings of love and hate towards each other. It's a very dynamic, strong, dynamic, emotionally laden process that happens between two people, and it's not just one-sided, believe me. The analyst is struggling, learning, discovering, and through the help of the patient also learns so much about his or her life, in addition to learning about the patient. But that information is used to help the patient grow and develop. I have written extensively about countertransference because early on in my career I observed that patients were often blamed for difficulties in therapy rather than therapists taking responsibility for treatment outcome. My dissertation was based on observing in the literature that women's erotic feelings toward analysts were perceived as the cause for failed treatments rather than considering that the therapist assumed responsibility for their own difficulties with their sexual feelings and treatment. Understanding countertransference is the most important part of a therapist's learning. It's the most important part to work to counter also the impulse for perfection. My paper, Stalemates in Therapy and the Notion of Gratification, is available to download on my website, and it goes into length about the dynamics of the patient-therapist relationship. One way I counter the tendency to perfection is to conduct free speak training groups every other Tuesday, where the therapist says whatever is hit on his or her mind in that hour. If they can have the courage to speak freely and challenge their timidity, then they can help their patient do the same. If they can't have it for themselves, they're not going to be able to help their patient free speak. I'm going to sign off for now. I hope you can like this channel. Press the like button there, and also please subscribe to the channel. If you have a Gmail account, you can subscribe. It's easy to make a Gmail account. If not, you can also always find me on the YouTube channel. And it's really nice to be here with you today and to be giving this 24th talk. I learn a lot by writing them up and speaking them, and I also like your comments when you put them up here, and also the comments, if I ask permission, I will put them on my website too, comments that you have. So thanks again. This is Dr. Mark Sehl for the signing off of the YouTube channel, Therapy for the Heart, and what makes for a good psychotherapy session. Bye-bye for now.